Good evening, good afternoon, good morning, wherever you're watching from. My name is Jennifer, and today we want to talk on health. What is PCOS? Today's topic is PCOS and how can PCOS affect you, affect your hormone, affect your ovulation, affect your health. So PCOS means Polycystic Ovary Syndrome. And it is common, like 27% of women, it is common in their body. The polycystic ovary syndrome. It is an hormonal disorder. But don't worry, because it's not just only you that have it. It is common, at least 27%. So, and what is the symptoms of this polycystic ovary syndrome? PCOS. How can you know that maybe that you have PCOS? One is irregular periods. When sometimes your menstruation will just stop. Your menstruation will stop and it will not come that month, and you know quite well that you're not pregnant. When you are having hormonal imbalance. Sister Maria, thank you so much for watching. Let me see who is watching. Manako, thank you so much. Let me say hi to my friends, my wonderful friends. Tabitha, thank you. Zara, thank you. Nana, thank you so much for watching. So, the topic is PCOS, Polycystic Ovary Syndrome. What are the symptoms that you may have for you to know that maybe that you have PCOS? Because PCOS will make you not to be able to conceive. PCOS will throw away your hormone out of the door. It's like you are going to have hormonal imbalance. PCOS will affect your ovulation. So one of the symptoms of this PCOS is irregular menstruation, where your menstruation will just stop and is not regular, or it will not be the way it's supposed to be. And somebody thank you so much. And it could also be heavily bleeding. Everybody will have our normal menstruation, but it could be that your own, when you're having your menstruation, is like you can't even go to work. It's like you are sick. You know what I'm trying to say? Then it could be that you have PCOS. And what is another symptoms that you could notice in your body that will make you to maybe know that you have PCOS is also excess androgen. What is androgen? Androgen is when your body is producing excess male hormone. If you as a woman and you're having male hormone in you, excess male hormone, you can have it, but you don't have it excess. But when the male hormone is excess, it causes your ovulation to stop or not to come, or it can make your menstruation not to stop. It leads to hormonal imbalance. And how can you notice that you have this PCOS with this excess androgen? By you noticing that you're having something that some men, that all men have. For example, men, they used to have hairs on their faces, right? So if you're a woman and you start having too much, it could be 1, 2, 3 is okay. But when you start having too much hairs on your face, which a man is supposed to have, that is a sign to show you that you have PCOS. So when you're having this excess androgen, the production of male hormone in your body, when it's excess, you start noticing this hairs on your face. Somebody's commenting. And what again? And also severe acne. Of course, there's so many people, all of us, we do have pimples, 1 or 2. But every time you are fighting with acne, we are fighting with black spot, real black spot, that you will tell yourself, I'm doing everything right, I'm doing this, I'm doing that, but it's not going. It could be that you have PCOS. And the other symptoms that you could notice in your body is this polycystic ovaries. What does that mean? That means enlarged when your ovary inside of you is enlarged, and there's this fluids. The fluids will now cover your egg. So now it will hinder that egg to be released. And when you notice that you are maybe on a big side, overweight, just your weight just started changing dramatically, going high, it could be a sign of PCOS. And what could cause this PCOS? I just told you, when you're noticing all these things, somebody like, thank you. When you're noticing all these little things on your body, then you start, and again, taking in is getting difficult. So now you will know what to treat. Because sometimes it's better to know what we have and not just waiting like that. So before I continue, please help me to share the video if you like it. Follow me on YouTube. I've made the decision to be making some small videos on our health, and follow me, guys. I could talk today, and tomorrow you could pick a topic. Let us educate each other. So you can follow me on YouTube, subscribe on my YouTube channel, Jennifer Maechler. The way is on Facebook. Thank you so much. So what is the causes of this PCOS? What could cause it? Excess hormone, excess insulin. That is the word. Excess insulin we could lead to this PCOS, and that is hormones that allows cells to use sugar in your body. That's like when you have excess insulin, it might increase this androgen. So that when that insulin that you have in your body is excess, it now make this PCOS to be high, meaning you now start producing the male hormone. It could lead to it, according to my research, and which leads to difficulty in ovulation. And when you are not ovulating, you cannot get pregnant. Another cause of this PCOS is also low-grade inflammation. You know, our white blood cell has this substance that fights infection in our body. So when you now have this low grade of this inflammation, it cannot fight things coming to you. That's why here comes whereby you could look for something, you change your lifestyle, look for something you could use to boost your immune system. And I have something like that for you in case if you want it. Inbox me, I will get it for you. So when you have this low grade inflammation, it also produces this androgen, because androgen is the main thing that causes the PCOS. And now this low grade inflammation can also lead to heart or blood vessel problem. That is why you need to boost your immune system. Another cause of this PCOS is heredity. What does that mean? Heredity means you inherited it. It's from your gene. Is in your gene. But all this I'm telling you, it could be treated. But so many women, when you don't know what is polycystic ovary syndrome, you might not know what you're going to treat. And all these signs I just told you, when you're having it, then you could know, oh, it might be this, then let me do this and this, because there are so many things you could do naturally to help you improve your PCOS. So, now, of course, I've been talking about this androgen. So when the androgen is now excess in your body, then it causes difficulties in ovulation. And also when your ovaries produce abnormal high level of androgen inside of you, your ovaries, the androgen that it produces is abnormal, then it causes PCOS, which makes it difficult for you to ovulate, which causes your hormone imbalance. When your hormone is not balanced, so If you hear people saying hormonal imbalance, one of the causes of hormonal imbalance is PCOS. There's so many causes of hormonal imbalance. When the woman hormone is not balanced, it now leads that the person might not be able to conceive. And one of the problem is what I'm treating today, PCOS. So next time, next week, next 2 weeks, I'll be bringing topics on this hormonal imbalance, what could cause it. So one of the topic that could cause your hormonal imbalance is PCOS. And you need to know what PCOS is, what could cause PCOS, that's what I'm talking about, and how you could treat PCOS. So now, when you now have this PCOS, what could it do in your body? What is the complication? Here comes. So it's bad. When you have it, I don't know that you have it and you're not treating it. It could lead to infertility. That is one of the common reasons of infertility. When you have PCOS, it could cause your diabetes. Because your PCOS, like I said before, it can make you start adding excess weight. And when that means eating disorder, when you start eating, having excess weight, it could lead to diabetes. PCOS, when you have it, it can cause miscarriage. That is why it needs to be thought about. Like I said, follow me, guys. Follow me on my YouTube. Subscribe on my YouTube. I'm going to be putting on videos, and I want us to be communicative. You can ask questions. We help each other, and when you know more, you could come to talk on one topic. Let us help one another. Whether you are in Africa, whether you are in Asia, whether you are in the USA, whether you are in Europe, we can help each other. And it also causes this metabolic syndromes. So this metabolic syndrome is whereby your high blood pressure will be high, your blood pressure will be high, your sugar will be high, you will have abnormal cholesterol. PCOS will lead to all this. It can also lead to depression. When you have PCOS, it could lead to depression. Some people, they narrate this depression. They will say, oh, she's just bored today. She's just sad. She's from sad. The person will not be coming out of the house. The person don't want to associate anymore. The person doesn't find anything good in his environment. That is depression. It's not when somebody wants to kill himself. You don't associate. You don't want to know about everything. You lock yourself inside the house. You quitted your job. You are depressed. PCOS can cause it. Too much anxiety. PCOS can cause it. Eating disorder that could make you. Do you know that we're talking about only adding weight? Do you know that PCOS can even also make you eating disorder? You start drying up. And there's a way a woman will be too thin, too slim. It also affects your hormone. You have hormonal imbalance. And this PCOS will now cause abnormal uterine bleeding. Sometimes you start bleeding without no reason. So you have to know what PCOS is, and PCOS is one of the reasons of hormonal imbalance, and is one of the reasons that contribute to infertility. How could it be treated? Today is a very short video. I'm leaving you guys. How could it be treated? 2 ways. Naturally, you can contribute to the betterment of your PCOS to make you have your ovulation, to make you have your hormone should be normal, because when you have hormonal imbalance, everything you see your period today, you will not see it today, or 3 months you do not see later, you see. How can you plan to conceive? So one is nature, by you taking care of yourself naturally. Another one is medical. It can be treated by you taking drugs. Now here I cannot help you. You have to go to your doctor. For example, they can give you something that has estrogen and progestin. progestin inside. When you take it daily, it can restore a normal hormone balance and also regulate, according to my research, and also regulate your ovulation. But in this part, you have to go to your doctor. This is the medical treatment of PCOS. Or there's one medicine that they give to people that have type 2 diabetes, because it's like almost people that has diabetes, they could have PCOS, right? So when they're treating them on this diabetes 2, type 2, there's one drug they used to give to them that called metformin, something like that. Metformin, yeah. So that's, according to my research, it's also help with that PCOS, and I cannot help you here. You see? Or surgery. You can go for surgery. It's not a good one. I don't think you like it. Whereby they will put some little pips, little holes on your ovaries that will now regulate your ovulation and your hormone. Nobody likes that, right? So now, where is the natural one? Natural way. There is no guarantee. We are not saying about cure. We are talking about what could help you. What might help you. What may or could help you. Your lifestyle. You can use some lifestyle tips I'm going to give you now. You could use it to support it and bring your hormone to be normal. One, if you are in a big side and you're waiting upon the Lord and it's not coming, the first thing you have to do is to drop a bit weight. Don't get me wrong. If you're weighing 90 kg, sister, and you drop between 5 and 10 kg, that means you still have your 85. And in 85, you still have all the curves in the whole world. Do you know that this 5 kg you just dropped? For that your hormone, you have done mightily well. Because when people hear about weight management, they take it to negative. Weight management could be just 4% of that much kilo, or maybe 5%. And that 5%, you are let me say 10% now, you are 100, and you brought it down to 90. Sister, 90 is still, you are much. But you see this 10% you brought down, it could do health-wise to you mightily. And never you starve yourself because you want to lose 5 kg. Never you starve yourself. You need things, natural things that have fiber. Because anybody waiting upon the Lord, never you skip breakfast. You must eat your breakfast. That regulates your normal cells in your body. Your first thing in the morning. You must eat your breakfast before you leave the house. When you want to regulate your hormone, is a must. But what are you eating? You must eat something that has fiber, something that has folic acid, because you need so much folic acid in your body. Now here comes. If you are looking for something you could be using as your breakfast that could help you, give you fiber, give you protein, give you vitamin A, vitamin B, vitamin C, everything your body needs, and even give you folic acid, and at the same time you drop down 1, 2, 3 kg, then inbox me. I have something for you. I will help you to get it. Another thing is that you have to do some exercise. That means for people that has this PCOS, just 30 minutes walk. I didn't say gym. No. 30 minutes normal walk. Or you put your YouTube, you see some exercise, you lie down and you do just 30 minutes. And you take some tips I'm giving you now, eating your right breakfast. And again, if you're watching me and you need something that has much folic acid inside, folic acid, not only that, combined with vitamin A, vitamin B, vitamin C, vitamin D, potassium, magnesium. I underline again with capital letter, folic acid for you, especially late 30, because that one you see in the market is like 200 grams, but you need more in your body to prepare you. If you need something like that, it's not in any shop to buy. I will help you to get it. So this Whether you're in Africa, whether you're in Malaysia, in any way you are, just inbox me. I forgot to put my number today there. But if you check my video of 3 days ago, 4 days ago, I put a number. Don't call, just WhatsApp me. Okay? And I will get happy to get all these things. So my sister, let us start taking care of ourselves naturally. Oh, you can go for surgery if you want. But try naturally first. To boost your fertility. To boost your hormone. To boost your ovulation. I wish you guys good luck. Don't forget to subscribe to my YouTube channel. I have made up my mind. Is in my mind. I want to start helping so many women, telling them about some tips, going ahead to make my research, and coming here to let you people know. Don't forget, PCOS is only one cause that somebody might have infertility. One cause that could lead to your hormonal imbalance. Not even fertility. Hormonal imbalance is that you could have 1 or 2 children. I wanted to have the 3rd one. But that time is when you're having hormonal imbalance. You try 3 years, it's not coming. Go for nature. Go for nature. If you're a bit big, come down small. Come down small does not mean you're losing everything. Just come down small, especially the front one. Because it affects your hormone. Take much vitamins. Fruit and vegetables. Take much folic acid. Take much fiber. And here comes, when you want something like that, then I can help you to get it. Then inbox me. Thank you so much for listening. I really appreciate it. Oh yeah, bye-bye. I have to leave you guys. I have an appointment. Thank you. Bye.